Hi, I'm Dr. Kristen Jacobs, and today we are going to do some filler treatments. So Claudia is our nurse practitioner, and she has been working really hard and doing lots and lots and lots of filler training so that she's ready to go and maybe inject you. So we have Linda. I almost called you Lisa. Goodness gracious. We have Linda, who, if you watch any of our videos in the past, it's been a little while, but she has been a book model back at 3 years ago. She's in my book now. So she's in a lot of our videos. We've done, oh my gosh, so many testimonials, and so she's amazing. And so we thought she's a really good candidate for Voluma. So before you start injecting, let's talk a little bit about the aging face, and let's talk about why you're choosing what you're doing. And if you want me to talk, I will. If you want to talk about it, you can.
Okay.
So
basically some general process with the aging process is, as we age, we lose our ability to produce collagen, hyaluronic acid, our fat pads that, as we're younger, fits tightly in a mosaic type pattern. As we age, they start to shrink, break down, and they start to fall. And that's kind of what creates, the under eye concerns, the jowling, things like that. So, not only are we addressing fat pads, but our muscles also break down a little bit. Our skull, the bone itself, becomes a little bit more hollow, a little bit more frail. And so, patients come in and they're kind of wanting that facelift. So Linda here, we talked a little bit about her biggest concern, which is her nasolabial folds here. Instead of putting product directly into that area, creating an unnatural approach, we want to start in the cheeks. So we use a product called Voluma that kind of acts as a tap. So we lift the area, we place the product, and it kind of gives that natural lift to help soften and camouflage those nasolabial folds.
perfect. I couldn't have said it any better. That was outstanding. So a lot of people do come in, and that's the first place that they point is the nasolabial fold. And just like Claudia said, we don't want to inject here because she's already a little bit heavy coming down this way, because as we age, everything comes this way. So a more natural approach is lifting this way, which is what we really want to see. And so that's where that Voluma is going to come in. And you're going to see improvement under the eyes. So take a look under her eyes. You're going to see improvement in her nasolabial folds. It's just, it takes this heaviness out. And then you're going to see improvement down in her marionettes and also down in this jawline. So Voluma, in my opinion, is where every single filler should start, unless of course it's lips. But we'll talk about lips in a little bit because it's the most natural way to do things. And so, like I said, that was absolutely perfect. So I'm going to let her get started. I'm going to go on the other side. We're going to let her get started, and I'm going to talk a little bit more about products and what we like to use. So, like Claudia said, Voluma is a product that we use in the cheeks because it acts like a tap. So it's the thickest, most robust product we have, and we can put it into the cheekbones, actually create some cheekbones.
Yes, ma'am.
So a lot of people are afraid of, if they have more of a round face, a lot of people are afraid of their face looking bigger, more round. But really what this can do is give you a more triangle-like face. And so, so go ahead and turn to me for just a second. And so with this product, like I said, it's where we almost always start. And then we have several other products that we can use for the lower face. But starting up here gives you that more natural-looking approach. So, go ahead. Okay, so what she's doing, she's just going to inject just a little bit of product in. So can you see that? Okay, okay, perfect. And we love our Voluma. It is incredible. And typically, so you can already, before you go, sorry. So you can already see there's a little indentation right here. She just put product right here. So it's incredible because you can already see the change. Voluma is really what you see is what you get. Sometimes you get a little bruising, sometimes you get swelling, but the majority of the time, it's what you see is what you get. And you can see she's going to create a cheekbone here, and that's what's lifting everything up. So, okay. So go for it. Yeah, okay. You're doing great. Yep. And so what I train all over the country for Allergan, so the makers of Botox and Juvederm, and I always say I can tell immediately when patients have, or when injectors have it, and I'm telling you, Claudia is incredible. So I'm training her exactly like I would inject, and again, so she's ready to help out and do some filler. But you can, I mean, so now look at it. This is what I love so much about it. Remember I showed you there was that little bit of an indentation. It is not there. Lean forward for me, Linda, please. And you can already see how nice this looks versus how flat she is over here. I mean, look at the difference even with her eye. I think, can you see it in the camera?
Oh yeah.
That's 0.2. Like, that's not even a half a syringe of Voluma. So I think this stuff is like a miracle. And it's incredible. And you can totally get so excited anytime we do filler. So, okay. So where are you going to go now? I'm going to go a little bit more in front here. Okay, wonderful. You doing okay?
I'm doing great. Thank you for asking.
And so some of Linda's other concerns are the lip lines around her lips. She really has great lips. They're a really nice, what do you call it? They have definition, and so we really are just going to put a little bit of product in to give her a little bit of volume, and then that will also help to plump those lip lines.
Duck lips.
Yeah, we don't want duck lips for sure. And she does have that tendency because her lips kind of go down. They're a little bit flat. And so we have to be very careful. And this is why training is so important. And with Claudia, we're doing multiple patients who have all different faces, all different shapes, all different lips. Because every face is different. And so there is, you can just go in and throw some filler in somebody's face, or you can actually understand it and see what's happening. And there's an art to it. There's a complete and total art to it. And I've been doing this for almost 14 years, and as I said, I'm a trainer, and so I love training. And you can see, she doesn't need me for Linda, because she's a really, I think, an easy patient to do, because we're just going to build up that cheekbone. And so she's doing amazing. She's doing amazing. Both of them, patient and injector.
Why you guys numb so well?
Good. So we'll do this one, and then we're going to take a look again. I just love how the transformation happens, and our goal is to look natural, but to still look like you've had something, but people can't figure it out. So refresh. We want that. That's the word, refresh. Okay, go ahead and lean forward for us. Look at how incredible that is. So turn towards me for a second. Oh my gosh, yeah. So you can totally see the difference here and the difference there. Are you liking it?
Yeah.
Okay, good. Definitely. Okay. So let me see you first. Turn this way. I'm about to go to the other side, I think. And just see. Chin down for me. So I see one spot that I'd like you to inject here first, and then we'll go to the other side. So I did
have my eye right there.
Yep, you got it. See, she's got it. So
She said that like a few minutes before that I didn't go one more spot.
yeah, yep, it looks good. And then maybe we'll see where we are, but maybe we do just a little bit of fanning back here, just to give you that. We're gonna do syringes anyway, so just to give. It's just a little different technique, so she'll come a little more superficial, and then she'll put some product just at the more superficial layer of your skin, and it helps to pull the lower face back a little bit more.
Okay.
So, go ahead and turn toward me a little bit. Go ahead and lift your head forward. And then chin down a little bit. So, go right. Yep, you got it. All right, go ahead and lean back for me. And what direction are you gonna go? So probably go down. Yeah, go down. Yeah, or do it your way. See, this is fine. Just let her do it her way, because no way is wrong. The way she's been doing it. So do it how you're comfortable. I told her I would not say a word today. And of course, I'm telling her what to do, and I'm making her nervous by putting her on film. But I think this is so important. You may do 0.2. I think this is so important to see that she is gonna have the skill set, that I have. So this is why I'm doing this. I know I torture her by doing things, but it makes her a better injector, in my opinion. So, I'm gonna just relax your hand for a second. See? Yeah, let's go forward. Good, good. So, just a little coaching, I can't keep my mouth shut. I try.
You just want everybody to be as good as you are.
Well, I thank you. I feel like
You're good.
Thank you. I do. I want her to be, and I want my patients to feel comfortable. So lean forward for me. And you know, I may be a little bit of a control freak when it comes to filler. I know, it's shocking, isn't it? So I think it looks really nice. Relax your face for me. Just for your mouth, yeah. Yeah. I think it looks good. So do you want to fan or do you want to go to the other side?
Well,
And the reason I'm saying that, she's just a little heavy through here.
Mhm.
So I want to try to get a little bit more lift through here. So it's your call. Turn a little bit toward me, sorry.
Toward you?
Yeah.
I want to do the other side first.
Okay.
Just to see where we're at.
Yep, sounds
Then we
good.
can come back and
Sounds good.
all that. Okay.
Yeah, so turn towards, oh, why don't you show her so she can see. See if she can tell the difference.
Oh, yeah.
Now, I feel like, you know, we don't see a whole lot of change yet in the nasolabial fold, but that's okay. And we want some nasolabial fold. We do not want to take that away. That's when you look fake. So I think it is a little bit softer. And we'll do the other side, then we'll come back. And so this is again, it's an art. It's going back and forth, and we'll try to figure out exactly what we want to do and need to do. So I'll take that for you. So what we'll do, if you're comfortable, we'll go ahead and start that side, and then we'll show her, and then maybe we'll turn it off at that point, and then when we do lips, we'll just film, and then we'll put it on. We'll post it later. That way you're not so nervous about doing that. You're welcome. So I'm going to step over on this side. Okay. Ready to get started? Yes, ma'am. And since this side isn't as flat as the other side, we'll see how much product she's actually going to use and how much lip she's going to get. And Voluma, we typically will do one syringe on each side. And sometimes if you're really deflated, you really need that pick-me-up, we'll do 3 or 4 Volumas, so 2 on each side, or 1.5, 1.5, because you need that extra lift. Our average patient does 4 to 6 syringes for a full face rejuvenation. There are some patients that actually need 10, 11, 12. And I know that sounds like, oh my gosh, how am I ever going to do that? And how am I going to afford that? But you take that one over time. So you don't come in and do 10, 11, 12 syringes at the same sitting. We'll do 3 to 4 because I feel like that's an appropriate amount. And then we have you come back and we do a little bit more. That way it's a slower process. It's more comfortable. That looks really good. It's more comfortable, and nobody's going to know that you had it done because it's a step-by-step approach. Voluma, when you put in a syringe on each side, you probably will want to repeat it at about a year's time. It depends on how much, if we get to full rejuvenation, let's say that, if we get to full rejuvenation, we're like, okay, this is perfect, I love this, then probably about a year you're going to want to do it again. But if we're not quite at full rejuvenation, what I'll say is, let's see back at 3 months. Every time you come in for your Botox, let's evaluate how much filler that you do need. And maybe you'll do a syringe then, or maybe we'll do it at the 6-month mark. So again, slow process, but you have to get enough in that first visit to see a change. And so that's why I say 4 to 6, and that includes the lip and the lower face as well. So it's now 4 to 6 Volumas. All right, let's see where we are. I mean, that pulled that out beautifully. Okay. Beautiful. Lean forward for us. How's it look, Maddie? Maddie's shaking her head.
It looks really good.
So let's see. I like that. I love this side. I think it's absolutely beautiful. I think she's still, I'm not telling you.
Well, thank you.
But it looks really, and that was like 0.3. I mean, that was even
Yeah,
a half a syringe. So you can
much.
see what a difference that did, and even in her lower face. So why don't you, if you don't mind, tell me what you're thinking now. So that was one syringe, and you can really see quite an incredible change. So at this point, you know, I think she's good, but I know we can be better. So what's your next step?
I definitely still see a little bit right here.
Yes.
On this side where she has a little bit more of a deficit than this side. Tilt your chin down for me. And then I do see just a tiny bit right here that kind of bothers me.
And where else on this side? About right here. How about in this area?
Haven't gotten there yet.
Oh, sorry. I said what else?
Yeah, but I do see she's a little bit more hollow on this side.
Yeah.
Than this side, which is why I wanted to go to the other side to see what the product did and see, because now
Absolutely.
she seems more full. So if I would have done the fanning, which obviously that's not wrong, to do that first, we would have had to come here and add even more product.
Okay.
So that's my thought process.
I love your thought process. So turn towards me. So I still think I want to do just a tiny bit back here, and the only reason is just to get lift. But you're right, she doesn't need it for volume, she needs it for lift. But we'll continue along here. So this is what we're talking about on film. You can see just a little bit of a deficit right through here. So we want to make sure we fill this in. But as far as the cheekbone goes, she did an amazing job building it. We'll put a little bit more in, on both sides too. But we're moving in the right direction. It looks good. And I actually think the nasolabial fold is more lifted on this side versus the other, which is pretty cool. So it doesn't take this long normally when we're doing filler, but obviously I want to take and show the slower process.
It seems not as deep.
It's not as deep on that side, yeah. I mean, it looks great. And that was like not even a half a syringe over there. So on one hand, a little can go a long way, but on the other hand, we're going to put a whole nother syringe in. She's still going to look absolutely incredible and not overdone. Now we're tweaking. Now we're going to fix, a couple other little spots that are bothering us. So what we'll do is we will put her before and after photos up when we're all done later this afternoon or tomorrow. And then we'll also video the lip filler so that we can put that up as well. But for now, did I miss anything from a patient standpoint? Do you feel like I covered everything, the time and how many and what our process is? Do you have anything else you want to add?
No, I think we went through it, and this was my first live filler injection. So,
so thank you. Yeah, thank you for being on it. Thank you for playing my games here, and thank you guys for watching. And if you have any questions, a lot of times you're going to come in and see Claudia for that filler first visit kind of consultation to see what you need. We really have to see your face before we can say this is what you need. But know that around 4 to 6 syringes is where we want to be, unless you're just lips. Oh, that's what I was going to say, is that lips are the icing on the cake. That's what I call them. So if she came into me and said, I just want to do lips, that's fine, but I'm still going to go through the whole process and say, hey, you really need to get a little bit of lift here, because if you really want your youth to shine, we need to give you those cheekbones back. And then you can come down and do the lips. And when we do lips, we often address this area as well. But let me show you why she needs 4. So 1 syringe Voluma, 1 syringe Voluma, lips would be a syringe, and then at the least, half a syringe here and half a syringe here. So there you're at 4. She really probably could use a full syringe on each side, but we'll play that one by ear. And she could use another Voluma after the 2 we're going to do to try to pull this back some and to give her more definition here. So again, it goes back to that art, and you don't want to just jump to lips because you think that's going to make you look younger, because I mean, it'll help a little, but really you've got to look at the whole picture. You have to look at your whole face. And Linda's been on our Skin Medica products as well. So we have worked on her a little bit of hyperpigmentation with the Lytera. Are you still doing the TNS?
Yes.
And so she's doing it. It's the recovery. Is that the one you're doing? Or are you doing
The recovery.
the recovery? I think just the red one.
Yes.
So she's still on our TNS recovery complex.
and she's getting that collagen stimulation that way. So yes, filler is an amazing thing. It's going to make her look younger, but she has to address everything else, which is the skincare, our collagen stimulation, and then of course our injectables. And then I don't know if you're still doing supplements, but you've done the supplements in the past, so she's still doing supplements too, because we want to help healthy aging from the inside out. So, okay, now we're going to get back to work, and you guys just give us a call if you need anything, if you want to be evaluated, and our number is 618-288-9117. Thanks for watching.